I see the comeback of that all the time is, oh, you care more about the economy than you care about people dying. Absolutely not. I care about people dying, and people are dying because of restrictions. And we're going to see that increasing more, almost 60,000 more deaths than the average. That is more people dying of non-COVID deaths, probably as a direct consequence of measures.
Dr. Keri Nixon is a consultant forensic psychologist and director of Nixon Consultants Limited. She is an expert in forensic risk assessment, domestic abuse and trauma. Dr. Nixon holds a PhD in forensic psychology, awarded by the University of Liverpool, a master's degree in forensic and investigative psychology, and a BSc in applied psychology. You're a very clever lass, aren't you?
I don't know about that.
How are you doing today? Thank you so much for joining me.
Thank you.
Brilliant. Now, Dr. Keri, could I just have you explain to our viewers, because the reason I got you on is I saw you on Sky News and I thought, that lass is amazing. I have to speak to her. Why is it that you believe that lockdown and our response to COVID-19 has done more to damage our nation's mental health than perhaps the virus itself would have done? Have I got that broadly right?
Absolutely. And I think it's important, what I tried to get across in the interview the other day is that I'm not somebody who is a conspiracy theorist. I'm not sitting here saying that the virus doesn't exist. It absolutely exists. But for me, it's about proportionality now. So back in February, when we were seeing the images from Italy, I think we were all scared. I was concerned. We didn't know what this virus was going to do, how deadly this virus was going to be. But then over the last few months, as we saw the figures, the death toll reduce, which was a good thing, obviously, and we saw life starting to get back to some level of normality. And then we have this escalating number of cases, and the fear was being generated again. However, the death rate is not gone back to what it was, which is a good thing. But yet we are living in this kind of fear-induced state by the government. And the impact of that, I think, is now more detrimental to what the virus is potentially going to cause. And it's about proportionality. So we're seeing ONS figures themselves, the Office of National Statistics. They said that 45% of people have reported there's been an impact on their well-being as a direct result of lockdown. We've seen domestic homicides have escalated. There were 5 women killed a week compared to pre-lockdown, which was an average of 3 women every 2 weeks. We've seen child abuse escalate. We've seen suicides. I mean, officially, the figures yet with suicides were difficult to determine because of coroner reports, but we're seeing reports of increasing suicide rates. So the impact of the lockdown is devastating on mental health.
What are you hearing anecdotally? Because you're very much on the ground here as far as mental health is concerned. Are you hearing from your own clients and from others in the profession that it really is? Are people sort of living in a heightened sense of terror, basically, thinking, I cannot go through another nationwide lockdown in which I cannot leave the flat, basically, unless for 1 hour a day or whatever it was back at the height of the lockdown?
Absolutely. I'm seeing in my clinic, I've had kind of an increase in adolescents coming to see me. I'm talking to parents whose children are terrified to go to school. I've spoken to adults who said that they won't be able to cope. They literally won't be able to cope with another lockdown. And then I've also spoken to people that don't want to leave their houses. They're so terrified. It's like they think that they're going to step outside their house and this airborne disease, like something out of the film Outbreak, is going to kill them instantly. the reality of what that coronavirus can do. For some people, they've got a very distorted view of how serious this is. And we know that it's a serious virus, and we know that there's terrible amounts of people that have died. But when people are so terrified to leave their houses, or when children are too scared to go to school, something's really wrong.
Definitely. The Prime Minister later today will lead a COVID-19 briefing, and this comes after the highest number of daily coronavirus cases since the outbreak began. What would your message be, with that in mind, to a government that might be contemplating a further measure of lockdowns, even nationwide as well?
I would like to say to Boris Johnson, when he reports those cases, why are they not reporting other figures that would help people put this into context? So, for example, the flu deaths in 2020 total 58,065. The COVID as of today, from the official figures as of today, deaths in 2020 are 52,631. So more people have died of flu. Why is that not being reported alongside those cases? Why are we not being told that the fatality rate is between 0.02% and 0.8%? Why are people not being given those figures? 80% of cases, the virus produces either no symptoms or mild symptoms. Now, that's not to say that, the cases that have died, as I said the other day, those cases the people that have died, it's terrible. And if anybody has lost a family member to COVID, it's awful. But it's about the proportionality. Mm-hmm. So if we could have that clear context, if people knew that, then maybe they would be able to then feel a bit more relaxed, knowing that it's not something that is going to instantly kill them. And if people had that context, maybe they would feel a little bit better. But it just seems the message that has been sent out by the government is one to induce fear.
Do you think the alternative of letting the virus rip through the nation would actually be worse than the consequences of lockdown itself? Because a lot of people will be listening to you and thinking, well, what would actually have happened had we followed the likes of Sweden, famous for its stance on lockdowns, as far as it didn't have one?
Mm-hmm. I think that's why it's really important to state that actually at the beginning of lockdown, I was actually quite supportive of what was happening. I wasn't somebody that was standing there saying we should not do this, because I think none of us knew what was going to happen. I thought that we were doing the right thing initially. I thought that we needed to have restrictions, and I think I was very apprehensive of what would happen in Sweden. Now that we seem to know much more about the virus, now we've seen how it's worked, now that we can see how it's worked in Sweden, I think we do need to have restrictions, absolutely. Social distancing, be aware, hand washing, hygiene, all those things, but absolutely not lock down again. Yes, I think we do need to. The young, healthy people will probably get coronavirus and not know they've had it. So I think we need to live with the virus. It's going to be around for a long time to come. All the studies, I'm not an epidemiologist, I'm not a virologist, but from the work that I've read of those experts, this virus is going to be around. The coronaviruses they've been around for many, many years. So we have to live with it. And we can't all hide away until it's gone, because it won't be gone. And actually, from the work that I'm reading from those experts, from the epidemiologists, is that actually we need to have that herd immunity. We need to have people who are healthy getting it. And the way that we're doing at the moment, we're preventing that happening. And therefore, the prognosis can't be a good one. And
I wonder, is that what you mean by a proportionate response, as far as mask wearing, track and trace maybe, sanitizing your hands upon entry of any building, those sorts of things, are they what you deem to be a proportionate response and one in which we can actually, I guess, manage to live with this virus instead of allowing it to control our lives and destroy our livelihoods?
Yeah, absolutely. In terms of things like mask wearing, I know there's a big debate on whether masks are valid in preventing the virus spreading. I've read some research from both sides of the argument, but even on the government recommendations themselves and in relation to businesses, they, offer that caveat that actually scientifically we're not sure how reliable they are. So I'm not going to stand here and say that I think mask wearing will prevent coronavirus being spread, because I think the scientific evidence is flawed. However, again, I'm not an expert in that area. I'm a psychologist. I think we need to be careful. I think we need to practice social distancing. I think we need to, live our lives, but with an element of being sensible. I think we also need to protect the vulnerable, whilst the healthy carry on living, so our whole economy doesn't fall. But in terms of the vulnerable as well, I've said we need to protect the vulnerable, but I also have something to say about that, because we have old people now who are committing suicide. On Twitter the other day, I saw a 92-year-old man who committed suicide. I've spoken to old people myself who say, I might have a year left, or I might have 5 years left. I would choose to live that with risk and see my family than live alone for those remaining years. And I think that's something we should listen to. There's people with dementia who are getting worse, because dementia will thrive on loneliness. They need social interaction. So I think even with the vulnerable, we need to listen to what people are saying and what they want. And we don't want old people just hidden away on their own, because that's just a tragic way to end your life.
And Keri, I think about those in those care homes, unable to see their loved ones in their final years of their lives. And what must this be doing to those people? They must feel desperately lonely. And as you say, there is evidence, isn't there, that the reminder of faces, of people, of place, that really helps with dementia and the side effects of it.
Absolutely. It's huge in dementia that, social interaction, as you said, reminds us of people's place. And for me, what we're going to see in the future in terms of people dying alone is going to be horrific. So I work with quite a few people in my clinic who have suffered things with PTSD and complex grief when they've lost somebody. And often when somebody has complex grief, it's because at the point of when the person died, there may be feelings of guilt or of anger. An argument may have taken place prior to their death. And that can really affect how somebody grieves, and it can lead to things like post-traumatic stress disorder. We're having old people dying alone, which for them must be horrific. I can't even imagine what it must be like to spend the last months of your life alone without your family. But on top of that, we've got family members who have lost people, who weren't able to say goodbye, didn't know what was wrong with them. And I really worry for those people and how they're going to cope with that grief moving forward. And I imagine there's going to be a lot of people who need a lot of psychological help to get over the grief.
I wonder, does that affect mothers as well? Because if you can't have your partner or a loved one be alongside you when you're given birth, and that's quite a traumatic experience for many women, isn't it?
Absolutely. And we've got to remember that even a perfect birth it can be traumatic. And you need somebody there helping you through that. But we also have emergency C-sections. We have stillbirths. We have horrific birth trauma. We have so many things that go on. And for those women to be completely alone without any support, It's awful. I mean, I've in my clinic, I've treated women for birth trauma and PTSD as a direct result of birth. And I imagine, again, I'm predicting that we're going to see an increase in every area that I work. I predict an increase. So suicides, university students who are being, contained in their halls of residence. We know that the first year of university is a risk for suicide anyway. That is going to increase. Child abuse, domestic abuse, all manner of things that are involved in my work. I am seeing an increase, and I predict an absolutely awful increase in the next 12 months.
What do you reckon the imposition of local lockdowns must be doing to people? Not to mention putting to one side the businesses and livelihoods, those that have thought, right, we're cracking on, we're COVID compliant as far as the new regulations are concerned. We can continue hiring people. We can continue taking customers. Only to find out that you're back to square one and unable to operate. People must feel like there's a sort of dagger hanging over their heads, that they don't know when at any moment that's going to drop and the government's just going to just put this iron curtain over their lives. It must be doing really quite severe damage. And as you say, I think it must feel like a genuine trauma for some people.
I think, you said putting aside the business, but actually I think anybody who runs a business, their mental health at the moment, they are going to be in a constant state of anxiety, because I think with the first lockdown, there were businesses that I know of that were just about hanging on, and they know that another lockdown will probably finish them. So you're going to have depression in business owners because they are so worried financially. And again, as I said, that will see an increase in suicides, I imagine, moving forward. And then you've got we came out of lockdown. So for the areas that have gone into to local lockdowns, they've had some social interaction. They've been able to see their family. They've been able to see their friends. They've been able to kind of carry on working or open their business or whatever it is. And then suddenly it stopped again and it's been taken away. And I think because it's been taken away again once it was reintroduced, that will have a bigger impact. There's the confusion now, because I think at the beginning of the lockdown in March, we all were very aware of what was happening in Italy and Spain and other places. And I think there was an appetite. In fact, Boris Johnson was criticised for not doing it sooner. I don't think that applies now. So people feel very let down. They feel very confused. They feel that they can't trust what is being told to them. So that then creates feelings of confusion and tension, anxiety. So I think it's going to impact on people much more the second time round in the areas of a local lockdown.
Are you actually worried about the impact that this will have on trust in professionals? And I'll explain what I mean by that. Do you remember, was it last week when Chris Whitty, yes, and Patrick Vallance, the medical advisors to the Prime Minister, advising the government on their COVID strategy. And they put up these terrifying graphs. Do you worry that if we don't see these increases that were predicted by the medical advisors that are advising this strategy, that actually there'll be a decline in the trust in science in general? And that could have some pretty serious consequences as far as public policy is concerned.
I think that's happened already. So I've got a close friend who said to me the other day, she said, I don't know who to trust, because you've got one expert saying this and another expert saying something else, and they're both leading experts in their field, but yet they're saying completely different things. Who do we believe? And for people who haven't got a scientific background, who don't understand the different theories and how science works, all that means is confusion, and they don't trust it. But we've also got somebody like Vallance, who 6 months ago was recorded talking about herd immunity. And yet now they say that doesn't work, and the complete opposite. So when we have one individual who has changed his stance, that then creates confusion and mistrust.
I mean, finally, I wonder if I can ask you to get on your soapbox and really go for it. Because if we think about the debate, on one side, we're at the more extreme end, we've got those who say that this whole thing is a hoax. That I don't know, you've got even some people who say it's a Bill Gates conspiracy. And on the other side, you've got those who reckon that we'll be tickety-boo if we just lock down the entire economy until this is all over, with no sight of a vaccine. I wonder what your message would be as someone who initially supported the lockdown measures. You've supported mask wearing, you've supported all of those other public health impositions and initiatives. What would your message be to how we can actually have a more sensible, nuanced debate and take the fear out of the room, take the conspiracy theories out of the room, and actually just discuss the facts and how we should actually respond to this?
There's always going to be conspiracy theorists, and the problem with conspiracy theorists is that it often weakens any kind of argument where you're criticising the mainstream media. So people are very reluctant. You mentioned earlier, and I don't think I answered it properly, about other professionals standing up and talking about the impact of mental health. And unfortunately, there's been very few. So I think people were reluctant to stand up and criticise restrictions and criticise lockdown in case they were seen as a conspiracy theorist. I myself, on my Twitter feed after the interview the other day, had people calling me a conspiracy theorist, and absolutely I am not. So I want to get that straight. I'm not a conspiracy theorist. I believed in this virus, and I still believe in this virus. However, we need to put those conspiracy theorists to one side, and we need to look at the evidence. We need to look at the evidence that is in front of us. We need to look at the number of deaths that are happening. As of the week ending the 18th of September, there was 139 COVID-related deaths. There was 9,523 non-COVID deaths. We can also see that week ending the 18th of September, the increase in non-COVID deaths is far above the national average, the 5-year national average. And that is because people are not going to the doctors. They're not going to hospital. Scans have been cancelled. As you said before, breast cancer checks have been cancelled. People are so fearful that they are not using the NHS. I spoke to a paramedic who said what they're seeing young people having heart attacks. They're seeing suicides, they're seeing self-harm, they're seeing mental health. I've spoken to nurses, I've spoken to doctors who are all saying the same things. So what I would say to people is look at the figures, look at what is happening, and then decide what we need to do. And I know that we have to be careful. I know we have to listen to the experts, but we can't lock down and face the economy being completely ruined. And I see the comeback of that all the time is, oh, you care more about the economy than you care about people dying. Absolutely not. I care about people dying, and people are dying because of restrictions. And we're going to see that increasing more, almost 60,000 more deaths than the average. That is more people dying of non-COVID deaths, probably as a direct consequence of measures. So if we're interested in saving people from death, shouldn't we do things that don't cause those people to die? And if we face more lockdown and we face people not going into hospitals, that figure is going to increase and increase and increase. And that's what I'm concerned about. I'm concerned about the knock-on effect. I'm concerned about people killing themselves, people dying of cancer, people are dying of heart attacks because they don't ring 999, people dying of dementia early when they could have had 5 more happy years with their family, children suffering domestic abuse and sexual abuse and all kinds of abuse in the home. these are the things that are really worrying me. And if they don't worry people that are watching this, then you really need to have a word with yourself and look at what is happening.
Absolutely. Well, I think you're a breath of fresh air, so ignore what they say on Twitter. If people want to actually find you on Twitter, though, hopefully not to send you abuse, where can they do so?
It's at Nixon Keri. So, and it's Nixonkeri, or
Brilliant.
just search Keri Nixon and you'll find it.
Thank you so much for giving up your time today.
Thank you very much.